Welcome, everyone. Thank you for being here with us. We are going to allow for a couple minutes up to 3:01. So anybody who is left to join the webinar can do it. After that, we are going to be starting. Thank you, everyone, for waiting. I do have here 3:01, so let's begin. Thank you, everyone, for joining us today to our monthly series of webinars. It is a pleasure to be here with you. I see that we have quite a diverse audience, and we are indeed showing some familiar faces, so to speak. We do have a couple of newcomers too. Thank you so much for that. For this particular set, we will be addressing the hidden cost of drop calls within a healthcare or medical patient center. It's good for you to know that it is part of CCD's commitment to actually create an educational platform regarding the positive impact that a well-managed healthcare contact center can do to your operations. This is pretty much why I would like to welcome our A team, as I do call them. Mr. William Harper, our Chief Financial Officer. Hi, Will, how are you?
Hi, good afternoon, everyone.
Thank you for being with us today. Mr. Harper runs our finance, accounting, and corporate development departments, including overseeing capital decision making, long term strategic investments, and overall financial performance. Mr. Edison Sepulveda, our vice president of business technology. Hi, Ed, how are you?
Hello, Marcel. Thank you. Looking forward to sharing some insightful information with our audience today.
Indeed, thank you so much for that. Edison oversees the business technology department and works alongside the business intelligence director to develop new and innovative ways to offer in the KPO industry. Last but not least, Mr. Rafael Peña Pelletier, our business intelligence director. Hi, Rafa. Welcome.
Hi, Maciel. Thank you.
Always, it's a pleasure. Rafa is the person in charge of developing innovative data-driven solutions for both external and internal clients. He works alongside with Edison. And actually, I made a mistake. Last but not least, and as your partial host, proud to be part of this amazing team. My name is Maciel Popa, and I work as the marketing and communications manager. As specialists in the patient care industry for more than a decade, we actually have identified a way to understand what patient support service requirements for specific radiology and diagnostic imaging centers are quite unique. This is why I would like to give Mr. Edison Sepulveda the floor so he can actually expand a little bit more in it.
Thank you, Marcel. So let's jump right into our topic of today. So we're going to cover the drop calls, and what we've seen is that this is a pervasive issue, especially in the imaging center industry, but across the medical sector and the healthcare sector. And basically, what is a drop call? Is when you don't have the capacity or the capabilities to serve all the volume, either calls or other channels that you're receiving in your center. But this has a negative effect on your financial outcomes, and we're going to see how significant that could be for a company of any size. But why is it overlooked by most of the imaging sector? We have identified three reasons. First is a lack of awareness. Some people may have the problem, but they don't know that they have it simply because they don't have the KPIs or the metrics that tell them that they have the problem. Then you may be aware that this is a problem for you, but you may lack the experience or the internal capabilities to address it or to solve it. And then you may have that experience and you may know that this is a problem for you, but you may lack the tools to solve it. And this is what we're going to discuss, just to give you a framework on how you can solve it and what are the tools that you need that can help you address this. And just to frame a bit the challenge, I'll let William speak on the financials that we've seen from some of our partners.
Yeah, so thanks, Edison. It's important for us to see the challenge in more than just the typical missed revenue opportunity from an abandoned call. First and foremost, we think of this as a missed opportunity to have a scheduled image process, or more importantly, maybe reschedule a canceled one. There's three other ways to think about it, and these are three ways that sometimes are overlooked and are just as important. One of them is the underutilized resources. As we know, we are as efficient as the usage of our machinery. So any cancellation that cannot be rescheduled would mean underutilized resources at that point in time. Additionally, it might also mean that a machine or a technician might be not working at their full capacity at any point in time, given the either cancellation or usage of the machinery not being met because of this drop call. Second, and this is very important for us, especially as competition continues to rise, not just in the US, but across the world, it is delayed patient care. Right now, patient satisfaction is one of the most important drivers of not just our performance, but of patient retention. And a delayed patient care might actually lead to switching costs and switching between providers at a much quicker pace than if we actually are able to maintain and engage them from the start. And then finally, something that is important because of the untapped potential, it's a barrier for new patients. An abandoned call might lead for new patients to actually jump before they do become a patient, before they enter our system, and it's easier to be tracked. So what we've ended up doing is finding out what would be the cost of an abandoned call for us throughout the year for a 3,500 call per day center. This is actually not even a large operation, as we all know. It might actually be more of a mid-sized operation. And we were able to annualize this at around $4.5 million a year.
Yeah, and William, something to note here is that this is estimating based on a drop call rate of low double digits. However, what we've seen is that the issue is more pronounced for most of the partners that come to us. And we've seen anywhere from 3%, which is when they have finally solved the problem, either through us or some other channel, but we've seen up to 35%. We could exponentially increase this $4.5 million a year. Furthermore, this is being amplified by a trend that we have seen, that American consumers and American patients are less patient. That means that if they were able to wait online for a call a couple of minutes, maybe they're waiting less than a minute now. And so this 35% that we've seen in time could become a 50%. So, in Maciel, I know that we discussed some personal experiences that we've had with this issue and this trend as well.
Yeah, definitely. I mean, it was not so long ago, and please don't look at me like if I was this old person. It was not 10 years ago that you used to call to an airline service, and actually to be able to book a flight, you might wait up to 45, 50 minutes perhaps. Nowadays, that's not the reality. And to actually give it a little bit more of context, the pandemic has not been quite good on that either, because people are a little bit more self-aware of how actually they invest their time. I do understand that Rafa has a very good context about this.
Well, yes, and thank you, Maciel. Well, in regards to addressing a specific framework to analyze this event, first of all, I would say that there are several ways to identify and measure, right, drop calls. But first of all, you need to I would say you need to dive deeper into your call data sets or call logs to be able to quantify those calls that are being abandoned by your patients or by your potential patients. And after that, and through a data mining approach, you would be able to target which of those patients were never able to connect again in the following days. For this type of analysis, we normally use a time frame of the 5 following days. And last but not least, you should cross that targeted patient list with data from other channels, such as chats, or, emails, or even walk-ins, just to make sure you actually identified the true missed calls among your callers. And I mean, in this line, this is an analysis of abandoned calls made with sample data from some of our clients from both the East and the West Coast of the United States. And by analyzing these data sets in different moments in time, we have discovered some interesting patterns that actually apply to both local and regional imaging centers. And as displayed here, for example, as you can see, on average, these centers receive around 3,500 calls per day, from which approximately 15% are being abandoned by the patient before before talking to an actual agent. So we're talking about over 500 possible appointments that are potentially missed every day. Of course, if nothing is done to prevent it.
It's quite an impact for your revenue.
It is. So, and as I was mentioning previously, when tracking these calls or those calls into the future, we have found out that only 48% of those patients are ever answered within the following 5 days. That includes 5% that actually decide to switch to other channels, such as chats or emails, due to the lack of response from their imaging center.
Yeah, Rafa, I think it's something important to stress because it's huge for a business that 52% of your total drop calls could become a patient for a competitor of yours if you don't take the calls in a timely manner. So that
Exactly.
52% is huge and very significant for the financial outcomes of an imaging center.
Indeed. So now, right, the reason why we're here, how does this event actually impact your revenue? By analyzing some of our clients' data, as I was previously mentioning, we have determined that approximately 60% of the total calls end up turning into actual appointments. And this is our target here, actual appointments. In what we call appointments ratio, which you can see on either of the 3 scenarios we are presenting. And also, we have seen that abandonment rate fluctuates between 3 to even 35%, as I believe Edison mentioned earlier on the presentation. That will depend, of course, on the region, company size, staffing levels, and other variables that might impact on that. So now, based on those premises that I just mentioned, we're presenting 3 case scenarios here for an average size imaging center, where you can have anywhere from 55 to over 380 missed appointments per day, depending on the rate of calls being dropped. So that being said, William, what would you say these figures represent in terms of financial impact?
Thanks, Rafa. So the way to look at it and the easiest way for us to grasp the magnitude of the issue is using a lower modality, a lower margin, a type of work, which we've been able to estimate at about $110 across the United States as an average. So just assuming that 15% drop rate, which is not an outrageous scenario, it actually is the mean or closer to the mean that we'd like to admit. We're talking about $18,000 a day in missed revenue because of abandoned calls. This could actually lead to, as we mentioned before, to 4.5 million. As Edison has mentioned, and it's something that is also important to note, this 15% is not an outrageous number. We've seen up to 35 when first contacted by certain imaging centers. So the magnitude could be even closer to $10 million a day of potentially missed revenue. We at CCD are able to help you with this in certain ways, but it's important for us to understand just how big the problem could be and why we tend to receive that much inbound request on fixing such a solution.
Yep, and that's indeed a huge problem for most imaging centers, William. And we've seen some of them that have taken some baby steps into fixing the problem. However, some of the current solutions that we've seen are either too expensive or outright ineffective. For example, there are three that I can bring up right now, and one is the easy but inefficient adding butts in seats. And what that means is that some imaging centers and some companies will just add people until they fit the problem. The issue with this is that this become inefficient from a financial standpoint, and eventually you will overburden your cost structure. And then there is the automated callback program. The issue with this and the negative effect is the patient experience. So when you are doing some automated callback programs, you may call the patient when they're having dinner with the family, for example, or in the middle of a work meeting. So it disturbs the patient at an inappropriate time, and it could have a detrimental effect to the patient satisfaction. And then we have seen some other outbound programs that are more structured towards a prime time hours, better hours of operations. However, the issue with this is that it may take considerable time from the time the patient call to whenever an agent or someone else can make those outbound calls. And what that entails is that 52% that you saw, those patients could be in that category and could become a patient for another center. So those solutions, while some of them are in place right now, are either ineffective or too expensive. But we have some solutions that we have designed that think might work better for any imaging center.
Yes, thank you, Edison. And one of those potential solutions that Edison is mentioning, and actually what I think is the first line of defense against this type of issue, comes simply from ensuring the appropriate staffing levels throughout the day. And this is something we call active workforce management. Well, as you can see here, we have a simple use case of an imaging center that is currently having, let's say, 15% drop call rate. After analyzing the agent distribution, as you can see, we can see that there are some time slots with agent shortage, but also we spot schedule opportunities here and there, right? So by using a simple algorithm called Erlang C, actually, to calculate staffing needs per hour, we can actually optimize agent allocation, but not simply increasing butts in seats, as Edison was mentioning earlier, but considering volatile call volumes and other factors such as patient patience and desired service level, among others, and I mean, making us able to reduce those drop rates from 15 to just 5%, and only increasing the agent roster by 4 new seats. And this is just, I mean, one of the things we could do to help you with the proper analysis to reduce drop calls and the economic costs associated with them.
Yeah, so it's important to also understand what would be the additional cost of running this new staffing model that Rafa has just mentioned. We've been able to estimate what would be the variable cost for additional agent hour in a US-based call center. What we're looking at right now is that for a maximum possible daily recovery revenue of close to $12,000, we can do this only with an incremental cost of $625 per day. The idea is that every single one of these agent hours, which we are able to target and adapt on a regular basis, given seasonality, frequency, and predictive models, as Rafa has mentioned, you can actually use a very small investment to try to capture as much as 12,000 per day. And this is, again, taking you only with a 10% improvement in abandoned drop rates, which we can actually even increase if we do see centers with higher than that number. At CCD Health, we can also provide additional cost savings, given that we have a very established and well-versed team in workforce management that allows us to save most of our centers up to 40% on their costs compared to a US competitor.
Correct, William. And this is achieved through what we call a holistic workforce management approach. And what does that entail? First, we use some advanced forecasting techniques, for example, time series analysis, to stay ahead of the curve, understanding what are the drivers of call volume and how we can predict it. And based on the output of that, we can staff accordingly to maximize the resources. And by that, we don't mean only the staffing requirements, but also space and technology. But then there's an additional step because we strive for continuous improvement, and we need to do some daily and intraday monitoring of the state just so that you can move people around and adapt to some sudden changes in the structure of your call volume. And the aim, the end goal of all of that is to enhance the patient care for all of your patients.
Well, and another solution you might consider, and this is something very popular nowadays, is actually artificial intelligence or AI, and more specifically, natural language processing, NLP, or speech recognition. These are solutions that can be implemented in a call center, let's say to automate tasks that take time from human agents. Therefore, you can reduce time on the phone and the number of agents needed. For example, conversational AIs can be used to ask initial questions, record information, and after they do that, then transfer the call to a live agent only if needed. So that way you can, reduce call volume that needs to be directed to an actual scheduler. And there are other tools as machine learning algorithms that can be trained and implemented by our team as per request.
Yeah. So in conclusion, what we end up seeing is that the financial cost of losing an abandoned call is way more than the cost of any of the solutions that we can put in place, particularly the first one, which is with a flexible, predictive workforce management team that allows for variable staffing to hit the peaks and the troughs at little to no additional costs, as we saw previously. And then the second, which is in the future, is how we can use AI to channel our patients, engage them from the start, keep them engaged, and reduce the number of abandoned calls, given that they do receive some attention from the start, and channel them to the correct person. In conclusion, we'd like to thank you for your time today and open it up for some Q&A.
Thank you, William, and thank you all, gentlemen, for the information you have shared today. As William said, we would like to open the floor right now for some questions, should you have any. I would like to remind you that the way of placing the questions is going to your box to the right, and it says right there, questions. Just hit the arrow, and you can start writing, and we'll be more than glad to answer them as much as we can in order to respect and be mindful of people's time. I do see that we have a question here, and I would like to share it right away. And this one is actually addressed to you, Edison. And it's the question is, what should I aim for, and how can I get to improve answering rate efficiently?
Yeah, this is a great question, Marcel. And at CCD, we try to do things data driven. So, based on our framework, what we have seen is that we can take the patients and to understand the financial impact of these drop calls. So, what we try to target is that patients, if for example is at 37 seconds 98% of all patients stay, then that means that your drop call rate after, if you take all calls at 37 seconds, is just 2%. You need to understand then and make the comparison of what that 2% means in terms of missed revenue, the cost, the opportunity cost and missed revenue and total cost of operations, versus just adding more people to the queue to solve that 2%. We will never target the 100%. However, what we've seen is 97, 98% is kind of industry standard.
Thank you very much, Edison, for that one. This one is actually addressed to Rafa, and this is related to what you discussed about, and it's a little bit more of context on patient retention.
Okay, well, patient retention or patient churn, which is the actual issue, it's an ongoing challenge for, let's say, practically every healthcare company in the United States. And for this subject, we should rely a lot on data science and machine learning to assess the right framework to retain those patients, because that's actually what you want to do with them. It's retain them. And there are several algorithms that we can develop together let's say, to help you identify and target those patients that are, let's say, more likely to churn or more likely to no show to their appointments, which is also another application we're developing here at CCD, and therefore be able to retain them in a proactive way. I believe this is the key term here. So you have to be proactive about retention so that so that you can act ahead.
Thank you. Thank you very much for that, Rafa. I do see a question here, William, addressed to you, and this is talking about the doing this with the stateside agents. The question is, what would be the best cost savings if we do it with the agents from CCD?
So the one thing CCD provides us, and I mentioned it before, is that we on average present our clients with up to a 40% cost savings than running it in-house or running it with a US competitor. One of the things that lets us do this is our advanced workforce management team, which allows us to staff accordingly at very little additional cost, and at the same time allows us to be able to allocate these resources to those periods of higher volume without affecting the full roster in ways that you might have to in other places. We maintain a very lean structure in other regards, but our importance and where we strive to work is preparing adequate staffing levels and workforce management that allows us to provide that quality service while at the same time providing you cost savings compared to what you could get in other places.
Thank you so much, William, for that. I do see we have a couple more questions. We'll be kindly reaching out to you individually. Thank you pretty much everyone that has been with us today for the opportunity of being with us and hearing CCD's best practice. We hope to see you on our next series of webinars, which we will be promoting. Remember, we would also be reaching out to those first 10 webinar registrants because you will receive your free staff and analysis. Thank you so much, everyone, today for being with us, and have a nice rest of your day.